Did you know that around 70% of individuals seeking treatment for substance abuse report a history of trauma? This staggering statistic highlights the intricate relationship between trauma and substance abuse, making it a critical topic to discuss. Trauma can take many forms, including physical, emotional, and sexual abuse, as well as neglect, accidents, or witnessing violence. Understanding how trauma fuels substance abuse is essential for anyone looking to break free from the cycle of addiction. Trauma can significantly impact an individual's mental health, often leading to conditions such as post-traumatic stress disorder, depression, and anxiety. These mental health issues can create a powerful emotional burden that individuals may seek to alleviate through substance use. For many, drugs and alcohol serve as a temporary escape from the pain, serving to numb their feelings and provide a fleeting sense of relief. Unfortunately, this coping mechanism can quickly spiral into a pattern of dependency and addiction, ultimately compounding the original trauma. Research has shown that individuals who have experienced trauma are at a higher risk of developing substance use disorders. A study published in the found that those with a history of trauma were significantly more likely to use substances as a way to cope with their emotional pain. This is particularly true for those who have experienced childhood trauma, which can shape a person's emotional responses and coping strategies well into adulthood. Moreover, the brain's response to trauma can create lasting changes in neurobiology. Trauma can lead to dysregulation of the stress response system, increasing levels of cortisol and other stress hormones. This heightened state of arousal can make individuals more susceptible to seeking out substances as a way to self-medicate and regain a sense of control. Let's delve deeper into the types of trauma that can fuel substance abuse. Research distinguishes between acute trauma, which is a single, overwhelming event, and chronic trauma, which involves repeated exposure to distressing experiences over time. For example, a person who has survived a car accident may experience acute trauma, while someone who has endured years of emotional abuse may be dealing with chronic trauma. Both types can lead to an increased likelihood of substance use as a coping mechanism. In addition, the concept of transgenerational trauma is important to consider. This refers to the transmission of trauma effects from one generation to the next. For instance, a child of a parent who struggled with addiction due to their own unresolved trauma may inherit not only the genetic predisposition for addiction, but also the behavioral patterns that normalize substance use as a coping strategy. Understanding this cycle is crucial in addressing and treating both trauma and substance abuse. If you resonate with any of this information or are struggling with trauma and its impact on your life, I encourage you to take action today. Check the link in the description for online therapy options. Online therapy has proven to be a highly effective resource for individuals seeking help, especially for those who may feel overwhelmed by traditional in-person therapy. It offers convenience, confidentiality, and the ability to connect with licensed professionals from the comfort of your home. Returning to our discussion, addressing trauma is essential in the recovery process. Therapeutic approaches such as trauma-informed care or TIC focus on understanding the impact of trauma on an individual's life and behaviors. TIC emphasizes creating a safe and supportive environment, allowing individuals to discuss their experiences without judgment. Additionally, therapies like eye movement desensitization and reprocessing, or EMDR, and cognitive behavioral therapy, or CBT, have been shown to be effective in helping individuals process and heal from trauma. Another important aspect of recovery is the role of building a supportive community. Engaging with support groups, whether in person or online, can provide a sense of belonging and understanding. Sharing experiences with others who have faced similar struggles can foster healing and help individuals feel less isolated in their journey. In summary, trauma can profoundly influence substance abuse, creating a complex interplay that makes recovery challenging. Understanding the roots of addiction and trauma is crucial for breaking the cycle. If you or someone you know is struggling, remember that help is available. Online therapy can be a flexible and effective solution, connecting you with professionals who can guide you toward healing. Addressing trauma is not just about stopping substance use, it's about healing the underlying pain that drives it. There is hope and a path forward, and reaching out for help is the first step toward reclaiming your life from the grip of addiction.